July is one of our most patriotic months, and for many of you, those vein problems are really weighing you down, and that's why today, Dr. John Rossi of Calcagno and Rossi Vein Treatment Center is here to help us declare our independence from those varicose veins by answering some frequently asked questions from patients. So let's get started right away, because these are some great questions today. We're going to start with Sue in Dillsburg. She says that she was told that varicose veins are just a cosmetic concern. Is there really something medically wrong? What do you say?
Well, what I would say is to Sue is that it's not a cosmetic issue. Varicose vein disease is caused by high venous pressure in your legs, and that's because your valves break down. And normally our venous valves take the blood back up to our heart and empty our legs. So in a normal person walking around, our legs are empty. If your valves are not working and the blood falls backwards, that's called reflux. That causes venous hypertension, and venous hypertension can cause a lot of difficulties in your legs. So it's not cosmetic, it's a medical problem.
Okay, which you can help with, of
Absolutely,
course.
absolutely.
Yes. Let's go to Steve in Lewistown, because I bet this rings true for a lot of people. I have had varicose veins for years. Why bother getting them fixed now?
Well, here's what I would say to Steve. Once your veins start to cause symptoms for you, then your venous hypertension has manifested itself, and it becomes relentlessly progressive at that point. You know, initially patients might start with heaviness or aching or fatigue at the end of the day. The symptoms come on gradually, but eventually, as you can see on the screen, it'll start to damage your skin. You'll get pigment changes, you get scarring in your legs, and then even at the end stage you can get venous ulcers, and venous ulcers are just venous gangrene. The skin will die because the pressure is so high that the arterial blood does not perfuse your tissue well. Those are very difficult to heal once they occur. So once you start to have symptoms, then I would say that it's worth getting evaluated.
Now, the next person actually has a question about the ulcers, which you just mentioned. She said, this is Mildred in Shippensburg, and she says the wound center actually helped her heal an ankle ulcer, but it is back, and so is there something you can do to actually prevent them from returning?
Yeah, this is a really good question from Mildred. Venous hypertensive ulcers are very difficult to heal. They can take months, even years to heal once patients develop them, and it's well documented that when you treat patients' venous hypertension, the ulcers heal very quickly. Not only do they heal faster, but it prevents recurrence. And we see patients all the time with venous ulceration who've been treated for 6 to 8 months, and we'll treat their venous hypertension and the ulcer could heal within a week or two.
Oh.
And it's very dramatic.
Wow.
It's really, so anybody with a venous ulcer who should get evaluated for venous reflux disease, because that treatment makes a huge difference in how fast the ulcer will heal and also whether it will come back.
Gosh, the message here today seems to be get it checked.
Yeah, get it checked out.
Then there's this gentleman, Jim in Harrisburg. He says he's had a painful red hard area in his leg for the past few days. He wants to know, is that something that you would treat at your office? Yeah,
Jim, sight unseen, that sounds like it might be a superficial phlebitis. What that is clot. And so when blood's not moving in your veins and the veins are damaged or the valves are bad, then blood will tend to clot. And superficial phlebitis are painful. They get red, they get hard, and they can be treated by treating the venous reflux disease. It used to be felt that they were relatively harmless, but that's not true, because anywhere from 10 to 25% of those patients, that clot can propagate and get into your deep veins, and then it becomes a serious problem, because then it can break off. So once you've got clot or symptoms of clot developing, and you can see that on the screen there, what happens is it'll become progressive, so you should get that evaluated. And yes, we can do things to help that, and the treatments are simple. They're done as an outpatient in the office, relatively little downtime, and so those patients benefit greatly.
So again, the message today, really, get these things checked, and you have free screenings coming up.
Yeah, next week, the 21st and the 22nd, Tuesday and Wednesday from noon until 7 p.m., you can come in and discuss your problems and get an evaluation and see if you have venous disease, and then see if there's anything that can be offered to you to help you out.
Very good. We can go online, give you a call to register. Thanks for being back with
You're
us
welcome,
today.
Amy.
Always cool to listen to these
Great to
questions
answer
from
those
viewers.
questions.
Yeah, have a great screening.
Thank you.
Have a
Thank
great
you very
screening.
much.